the free electron that basically can attack biomolecules such as membrane proteins, DNA and RNA itself, the very genetic material.
Not only the DNA that we find in the nucleus, but it can also damage the mitochondrial DNA. We now know that the mitochondria, that's the part of the cell where energy is produced, also has its own form of DNA, and it's like a miniature kind of nucleus. It's also producing DNA and messenger RNA, and many of the toxins that can damage the DNA in the nucleus can also damage the mitochondria.
We're bombarded with free radical damage, which causes oxidative damage in our cells. So when you consume foods like green vegetables, and especially like these vegetables that I'm talking about, you're going to see a huge difference in what your cells are doing.
The body has very elaborate detoxification routines to neutralize free radicals. Now, free radicals can be beneficial. They help white cells attack bacteria and viruses and fungi, for example, but in excess, they will start damaging normal tissues, including cell tissue membranes and the DNA, and lead to mutagenesis, which can lead to carcinogenesis. Nutrients like selenium, vitamin C, and vitamin E are all part of our antioxidant detoxification system. Selenium, for example, is part of the whole glutathione system, which is very well documented to help squelch free radicals, and that minimizes any damage that excess free radicals can cause in our normal healthy cells. Vitamin C is also a powerful free radical scavenger. That's one of the ways it works in terms of fighting infection. Vitamin E also is that. Vitamin E and vitamin C work together. Vitamin E tends to protect vitamin C, and vitamin C tends to protect vitamin E. Vitamin E works very well with selenium. In fact, selenium and vitamin E in some free radical squelching reactions can actually substitute for each other. So not only are these nutrients important individually, but they also work synergistically with nutrition. You have to think differently than drugs. Nutrients tend to work together.
Most oncologists really tend to tell patients, do not take antioxidants, do not take nutrients while they're getting conventional treatment, because the conventional treatment is pro-oxidative and produces free radicals, and since the antioxidants tend to neutralize free radicals, it might interfere with the treatment. So that's the standard line that they have. But the actual studies do not bear this out, because the nutrients deal with cancer cells different from the way they deal with normal cells. So that in many situations, the normal cells will actually be enhanced by the nutrients, whereas cancer cells, they may actually be killed, or the conventional treatments may actually be enhanced by using these nutrients and so on. Now, there have been some major studies just in the last year or two, one by Dr. Simone, Charles Simone, who is a radiation oncologist and chemotherapist out in New Jersey. For years, he's been looking at this question as to whether nutrients and antioxidants are beneficial or harmful for patients receiving conventional treatment. And the vast majority of the data shows that it does not interfere with conventional treatments, and in many cases it actually improves the results, and virtually in all cases it tends to reduce the side effects. So this is very important.
Other vitamins include vitamin D, especially vitamin D3 and vitamin A. Vitamin D3, most people, when they are diagnosed with cancer, if we drew vitamin D3 levels on them, they'd be very deficient. So we encourage people to have healthy doses of vitamin D3 to prevent cancer, and higher doses if they already have cancer.
Vitamin D tends to slow cell division. Well, that's important because one of the hallmarks of cancer is it tends to divide without restraint. Vitamin D directly works on the DNA through a nuclear receptor where it suppresses proliferation. It tends to shut down not normal, but only abnormal replication. So it causes cells to grow more slowly, particularly in tumors. Now, you do want cells to divide. If you have an injury or cut, you want cells to divide. Vitamin D doesn't seem to block normal cell division. It seems to selectively block, which makes it such a wonderful vitamin, abnormal cell division. In addition, it tends to foster differentiation. One of the hallmarks of cancer, they grow without restraint, but they also tend to be undifferentiated. In a simple sense, what that means is cancer cells don't tend to look like the tissues in which they develop. You know, all our tissues in our body have cells that are very distinctive. You know, any second-year medical student can distinguish a neuron from the brain, from the cell lining the small intestine, from a liver cell, from a pancreas cell. Cancer cells, however, are very primitive. They're very amoeboid. You can take a breast cancer cell and a colon cancer cell and a pancreatic cancer cell, and even a good pathologist might have trouble distinguishing them when they're very, very aggressive. They tend to lose all distinguishable characteristics. You really can't tell where that cell came from. That's known as dedifferentiation. Well, what vitamin D does, it tends to foster differentiation. That means it tends to foster the normal development of cells so they become the mature version of what they're supposed to be. And it even does that in tumors. Now, interestingly enough, as tumors become more differentiated, as they mature more normally, as they become more like normal tissues, they lose their ability to replicate. When cells become differentiated, they lose their ability to divide. So consequently, vitamin D has a two-pronged approach against potential cancer or developing cancer or actually formed cancer, where it tends to encourage those tumors to become more differentiated, more like normal tissue. With cancer, you always want that. And they differentiate more normally, and they lose their ability to replicate without restraint. So vitamin D has a two-pronged effect against cancer that even just this month is being worked out. But it's very powerful. This is the one vitamin where even conventional physicians are really getting on the bandwagon. It's estimated that vitamin D deficiency is probably not only epidemic, but the most common deficiency in the Western world. It's been estimated that 80% of adults are deficient in vitamin D. And this is coming out of the conventional medical literature. There was a recent major conference in 2007 discussing vitamin D, where scientists from all over the world, from major institutions, are finally talking about a nutrient with respect. It's kind of extraordinary. Vitamin D is getting a respect that no other nutrient in my career has ever gotten. And that's good, because it's going to open the door for these scientists to think more openly about other nutrients.
So there are herbs also that will help us. Rosemary, the rosmarinic acid is wonderful. It's a lovely anti-inflammatory for the body. Things like turmeric, another natural anti-inflammatory.
Curcumin has been shown in many studies, mostly in cell lines in vitro, to have a significant inhibitory effect on a wide variety of cancers. They cause cancer cell apoptosis, cancer cell self-destruction. And there's some studies now already with the use of curcumin and brain cancer and other cancers as well, with very positive and promising results, especially in animal studies. Clinically, we see very good improvement in patients with various forms of cancer with the use of very high dose and very highly bioavailable curcumin.
Curcumin has profound anti-angiogenic effects. It suppresses COX-2, the inflammatory response, which is very critically involved in angiogenesis, and it works on multiple levels to block the growth of blood vessels that fuel tumors, as does green tea.
Green tea is very important both for the prevention and for the treatment of cancer. Again, you have to think about the bioavailability of green tea, and you have to use compounds that have higher bioavailability.
There are a whole range of these natural compounds. Quercetin is another one, all of which have a really appreciable effect in the animal studies, and the in vitro laboratory studies show this quite clearly.
Another product that they've used is a special extract of ginkgo biloba, different from what's available in health food stores. And that seems, in some experimental studies, seem to show there was evidence that it reduced the side effects of radiation. It helped to reduce the fibrosis effect.
Another one is bindweed. Bindweed is a weed that's found in lots of places in the United States. It grows wildly and is extremely available, to say the least. And that has been proven to have anti-angiogenic effects.
There are other tumor reduction type things like cat's claw, paudarco, the immune modulators like ashwagandha, and some of the ginsengs. We also encourage people to have the mushroom complexes like AHCC. And the like. There are many different variations of them.
We're now very fortunate to have a myriad of natural compounds that can both directly cause cell apoptosis and also significantly improve the immune system. So for example, poly-MVA, which not only causes cancer cell apoptosis, but also at the same time improves the health of our own healthy cells. Another very important compound for the prevention of cancer is DIM, which is an extract from broccoli that is very important for the prevention of breast cancer, but also for the prevention of certain other cancers like prostate cancer. Other compounds like melatonin have been shown to improve survival in certain cancers as well.
We encourage people to use pancreatic enzymes. When you take enzymes on an empty stomach, they actually act as anti-inflammatory and anti-cancer.
In our office, based on our experience and based on the scientific literature, the single most important supplement that someone can take are pancreatic enzymes. And I know to a lot of people that's going to sound surprising. That sounds weird. People who know about pancreatic enzymes will know that these are digestive enzymes, and they've been identified for over 100 years. Trypsin, the main pancreatic enzyme, was first identified in 1858, and it's known to be one of the main digestive factors in terms of breaking down protein foods. We've known that for over 100 years. Dr. Beard in 1902 first proposed that pancreatic enzymes, in addition to their digestive effect, represent the body's main defense against cancer and would be useful as a cancer treatment. And he actually used a tumor model to test pancreatic enzymes with near 100% success, published it in a major journal, and it was vilified because even then the idea of using natural substances to treat a terrible disease like cancer, which in those days was so mysterious, seemed completely and totally preposterous. Physicians who knew about Beard's work then applied it to their human patients with cancer, because in 1902, 1906, there really weren't a lot of orthodox conventional treatments. Chemotherapy wouldn't be developed until the mid-1940s. So there were physicians willing to try his enzymes, and with great success reported in the medical literature. However, the more successful Beard was, the greater was the backlash. Nothing's changed in 100 years. There's no question pancreatic enzymes have an anti-cancer effect. People that wish to prevent cancer, I think they should take enzymes. I myself take about 8 capsules 3 times a day. They're available in the health food stores as a non-prescription item. The third component of our therapy, first 2, diet, supplements with pancreatic enzymes, antioxidants. Third component, which is as important as the other 2, is detoxification.
Detoxification is crucial for the prevention of cancer and also for the treatment of cancer. How could we treat someone with cancer, whether it's with natural compounds or with chemotherapy, while their body is riddled with toxins?
In our program, we use detoxification aggressively. For example, when we're treating cancer patients and we put them on the diet and the supplements with the large doses of enzymes, and our average cancer patient can take 100 capsules of pancreatic enzymes a day, those tumors start dying, and that's wonderful. But tumors are very abnormal collections of cells. Again, everybody knows that, every medical student knows that, every layperson knows that. They produce all kinds of molecules and proteins and DNA that is not found in normal healthy tissue, and they produce hormones that are not found in normal healthy tissue. One of the hallmarks of cancer physiology is they have their own mechanisms, their own enzymes and hormones are not found in normal tissue. Well, that's great. When those cancer cells die, wonderful. But then all these molecules are released in the bloodstream, and a lot of them are foreign to normal healthy tissue, and people are going to get sick. It's like you're going to get a lot of toxic debris. Detoxification routines include simple procedures. For example, our most famous or notorious one are the coffee enemas, which come right out of the orthodox medical literature. They were in the Merck manual right up until 1977. All the nursing texts from the 1950s and 60s recommended coffee enemas. During the 20s and 30s, there were many articles in the mainstream academic literature showing value of enemas in general and coffee enemas in particular. There's no mystery as to how they work. Caffeine is a very active biomolecule. They use it to treat migraine headaches. They use it to treat asthma. When you take caffeine rectally as an enema, it stimulates certain nerves in the lower bowel, technically the sacral parasympathetics. When they're turned on, they feed back to the liver within seconds and cause the liver to release all its toxins and stimulate both phase 1 and phase 2 detoxification. Nothing, in my experience, helps the liver work faster, more efficiently, more effectively than coffee enemas. For a cancer patient who's breaking down huge masses of tumors, and most of my patients come to us with huge masses of tumors, coffee enemas can be life-saving. They get the liver to work better. Tumor waste are filed through the liver, and that's where they're mainly detoxified and neutralized and prepared for excretion through the intestinal tract. Coffee enemas stimulate that whole process to work more effectively. Now, in addition to coffee enemas, which cancer patients will do 4 times a day or even more, depending on how sick they get, we use a whole series of other procedures. We have liver flushes, which are those are more widely known in the alternative field. These are just simple procedures, again, to get the liver work better. My mentor, Kelly, used to say, if you can get the liver to work better, you can get over just about anything. There's some truth to that. Liver is the real key. It isn't enough to break down a tumor. You've got to get rid of those tumor waste, otherwise the patient can die from autointoxication. Also, the body mounts autoimmune reactions against tumor waste. One reason patients often get so sick on chemo when it works is not because it's failing necessarily, because they're dying of toxemia. I mean, not that I'm a proponent of most chemo, but when it does work, you're killing cancer. They don't think about the fact they've got to get rid of these tumor wastes.
N-acetylcysteine and alpha-lipoic acid. Together, they create glutathione, which is one of the main detoxifiers of our liver. And often, when people have cancer, their livers are so toxic that they can't synthesize healthy immune hormones for them anymore. So that's why we encourage people to detoxify their liver.
Glutathione, especially in the IV form that we use for many patients with cancer, have been shown in clinical studies to improve not only the outcome, but also it helps people manage and to tolerate their chemotherapy. So the side effects are significantly mitigated with the use of intravenous glutathione, and some studies are already pointing to a positive effect in terms of morbidity and mortality with the use of intravenous glutathione. These studies were done with glutathione in combination with chemotherapy. So here we see a few things. One, that the use of antioxidants and chemo can work together. We don't have to buy into this soundbite that, oh, you're taking chemo, you're using chemo, you have to stay away from antioxidants and anything natural. In fact, the studies show the opposite. Here's glutathione, a very potent antioxidant, used IV, and when used in combination with chemotherapy, the results were very, very promising and beneficial.
So detoxification is absolutely critical. We use juice fasts. Juice fasts are wonderful. When you stop food for a couple days and take nothing but juices, for example, we use juice fasts. You basically put the systems at rest so they can recuperate from the battle. You know, getting rid of cancer, repairing a damaged body is a battleground, and the body needs rest. You know, none of us would think about working 7 days a week, although I do at times. You know, we need a day off. The body needs a break from repair, and actually juice fasts will often do that. They'll kind of put the body at rest so the body can recuperate. It's like taking a physiological vacation so then the body can get back to the battle of getting rid of cancer and repairing damaged tissue.
It's very important to do juicing, to juice vegetables, to juice some fruits, and also to puree many vegetables, and to consume these vegetables in forms of juices and purees in high dosages, because this will help the body detoxify in a holistic way, in a comprehensive way. The vegetables know how to detoxify us in a complete way. I'm talking about broccoli, cauliflower, burdock, beets, carrots, parsley, et cetera, and used in combination can significantly help our liver and our bodies to detoxify.
So we use juice fasts, liver flushes. Coffee enemas are predominant. We also use colon cleanses, which are important. A lot of debate about the value of colon cleanses. In practice, I've seen the benefit over and over again. Our diet produces a lot of mucus. You get this dried mucus in the intestine. You know, it just blocks normal function. It can lead to diverticulosis, chronic constipation. None of that is good. We have a series of colon cleanses that really help clean out the body from 30, 40, 50 years of bad eating so that digestion occurs more efficiently, the absorption, utilization of nutrients is more effective.
A lot of my patients think that evacuating the bowel once in 3 days is normal because that's what they did for many, many years. So you have to re-educate people and say, listen, if you don't detoxify, if you don't eliminate, it's sitting right there and, causing toxicity of the entire system.
In terms of the treatment of cancer, we must take a holistic approach and approach each patient individually. Everyone is biochemically unique, physiologically unique, spiritually unique, and everyone has to be understood as a unique individual. And therefore, the treatment has to be individualized for each patient.
When patients come to traditional medicine for cancer therapy, again, it's all about the medication that they use. When people come to complementary physicians, we test vitamin, mineral levels, absorption, digestion. We test for heavy metals. We try to get the immune system strong so it can do the job it's supposed to do to attack the cancer. There is research on a product called Avamar, which is a fermented wheat germ extract that helps to decrease the glucose uptake in cancer cells. Many years ago, a researcher, Dr. Warburg, found that glucose is grabbed by cancer cells and it gives the cancer cell the energy in its metabolism to multiply faster than regular cells. Cancers need sugar in the blood glucose, to thrive on. The Avamar product decreases the glucose uptake into cancer cells, so it makes it more difficult for cancer cells to exist. People that have high-carb diets, people that are diabetic and are overweight, have higher risk of cancer and progression of cancer than those people who don't eat lots of carbs and therefore don't have lots of sugars on board.
The trend, and this is certainly the direction of the future and the direction of the present, is to use biologicals, biological response modifiers that can modify the body's own natural healing capacity. So rather than going against the body and attacking the body or attacking the cancer, we're now using the body's own internal knowledge and defenses, yet strengthening it so that the body can do what it does naturally. And we're now realizing, and we realize this in the holistic world for years, but now even some people in the conventional medical world are now understanding that the body can potentially heal better than any drug that we'll ever be able to discover. In our practice, we're using the Dr. Emanuel Revici's protocols for the treatment of cancer, the late Dr. Emanuel Revici. He is known as one of the foremost holistic medical doctors vis-a-vis the treatment of cancer. He was a genius not only in the medical field, but he was also a biochemist. And so he understood biochemistry just about more than any doctor. And he understood how biochemistry and the basic elements of the periodic table can be used in conjunction with fatty acids that he had a deep and almost prophetic knowledge of, can be used in combination to modulate our biochemistry in such a profound way that gets to the roots of some of the causes of cancer. And briefly, I can tell you that his methods were based on the knowledge that life, both in the organic world and also in the inorganic world, in the world of the elements, can be divided into alkaline and acidic. And our bodies go through these diurnal phases of sometimes we're alkaline and sometimes we're acidic, and we need both. And frequently with patients who have cancer, they're stuck in one phase. But Dr. Revici not only identified this as one of the deeper underlying causes of cancer, but he also had methods of treatment to get the body back into those diurnal